Hello, everybody, and welcome to today's webinar on applying for the Stabilization Grants, hosted by ACNJ.
Buenos días a todos, bienvenidos al día de hoy a la charla para información del subsidio de estabilización de cuidados infantiles dada por ACNJ.
This webinar is being presented with funding from the National Association for the Education of Young Children,
Esta charla está presentada gracias al apoyo de la Asociación Nacional para la Educación de Niños Pequeños,
Child Care Aware of America,
también la Asociación Child Care Aware of America,
and the National Association for Family Child Care.
y la Asociación Nacional para el Cuidado Infantil Familiar.
This webinar is being presented with live Spanish translation.
Esta charla se presenta con interpretación en vivo al español.
In order to receive Spanish translation, please click Interpretation at the bottom of your screen and select Spanish.
Para poder acceder a la información en español, por favor diríjanse al fondo de su pantalla, al botón que dice Interpretación.
And without further ado, I will turn it over to Senior Policy Analyst Cynthia Rice.
Bien, sin más vueltas, vamos a comenzar con la presentación, la señora Cynthia Rice.
Good evening, and thank you all for giving up a part of your evening to be with us in making sure that the maximum number of New Jersey child care providers, both center-based and family child care homes, benefit from the stabilization grants made available through federal funding from the American Rescue Plan. My name is Cynthia Rice, and I'm Senior Policy Analyst at Advocates for Children of New Jersey, or ACNJ, our state's largest multi-issue child advocacy organization. Thanks to the support, as you've heard, from the National Association of the Education of Young Children, Child Care Aware, and the National Association for Family Child Care, ACNJ, along with its partners, have been working to ensure that our state's child care providers have equitable access to these stabilization grants. This is part of our funders' national effort to build towards a more equitable access on these funds, as well as other funds that the federal government may provide in the future. We know that while these funds are critically important to programs within the child care community, whose financial struggles began long before the pandemic, the process in attaining those funds can be overwhelming for some. Let me say that we are here to help. Tonight, we will be providing an overview of why these funds are so important to your programs and what you have to do to successfully apply for the funding. In the coming weeks, ACNJ will be holding a limited number of smaller group sessions for those who feel they may need additional help. We will be talking about these small group sessions throughout the presentations. Leading us tonight will be Rebecca Zaidel-Lupianes, a longtime friend and advocate for New Jersey's child care system. Rebecca is now an early care and education and nonprofit leadership consultant, but has supported the child care community for years, particularly in Morris County. She is currently serving as the project director for Georgia State University's School of Public Health Center for Research on Interpersonal Violence. Being a former child care program center director, Rebecca has intimate knowledge of the child care program operations and pedagogy. Rebecca will be joined tonight by two leaders in our state's child care community. Winifred Smith-Jenkins, who's the Senior Director of Zadie's Early Childhood Center in East Orange, and Shernette Frey-Palmer, the owner of We Care for All Family Daycare in Patterson. Both Winifred and Shernette have successfully applied for and received their program stabilization grants and will be on hand tonight to talk about their experiences in the application process. So let's get to work. Rebecca?
Good evening. I am thrilled to be here with you all this evening. And just bear with me for 1 minute, and I'm going to pull up our slides. Yeah. I'm gonna run backwards really quick. Just so you get a glimpse of what we're in for this evening. So thank you, Cindy, for that wonderful introduction. And again, my name is Rebecca Zaidel, and I am so happy to have the opportunity to talk with you all this evening about understanding and applying for the Child Care Stabilization Grants. Next slide. And so these funds are designed to help, as Cindy said, stabilize the childcare sector. And that is approaching it from three at least different perspectives. That from the perspective of the business, from the perspective of supporting children and families, and from the perspective of supporting the childcare workforce. So for some of you, this may be just another application in a string of applications that you filled out since the onset of the pandemic. And for others of you, this may be the first time that you're applying for government funds. And so our hope this evening is to walk you through that process and look at how this grant is a bit different than previous grants and why it's so important that you do apply for these funds. So before we jump into the next slide, I want to get your perspective and get a better understanding of your experience with the grant process. So we are going to launch a couple of polls, and your feedback would be really helpful for us. So the first really is, let us know of all the federal funded stimulus program grants that have been issued, which ones have you currently already applied for? And there's a number of them out there. If you'll remember early on, there was the Paycheck Protection Program. We have the Employee Retention Tax Credit, the Families First Coronavirus Response Act, the Economic Injury Disaster Loan, and perhaps you didn't apply for any of those, and that's great for us to know as well. All of these programs and grants build upon each other, right? And so each of them had their unique, how would I call it? Their unique niche that they were intended to serve, right? The Paycheck Protection Program helped with payroll, covering payroll expenses. And so this ARP stabilization grant is different in that it allows us to use funds in a different way. And so once we have those responses in, we can share what those are. Thank you. And so it looks like we had a fair number of people utilize the Paycheck Protection Program. This is great. Thank you, Catherine, for sharing that. And then we're going to launch our next poll, which is, have you applied for the retention and hiring bonus? This is sort of the first part, similar, same pot of funding, the ARP funds, but had a different purpose, right? This was to help us with retaining and recruiting new staff. And again, very specific in what its use is for, which is very different from what this new grant is. While this new grant does have the ability to use these funds for staff and personnel, it also gives you at least 6 other categories that you can use the funds for. It seems to be the most flexible of the grants that we've seen so far. And once we have everyone's responses, Catherine will share what those are. There we go. Great. And so then we'll just go into our final poll in this section, and just curious, if you hadn't applied for any of the federal stimulus funds before, what would be the reason why? And this is helpful for us because then it helps us guide how we develop programs, what additional support and TA you might need, and what additional funds that we might want to start to advocate for as well. So once we have everyone's responses there, we can share those as well. And when we get into looking at the categories for use of funds, you'll see that you're able to pay for rent and mortgage. You can use it for payroll. You can use it for mental health services. That's a new category that we haven't seen before in any of these other programs. In addition to the PPE and cleaning and COVID related equipment, as well as materials and supplies that support the continuation of your program. So Catherine, do we have the response for those yet? Great. Perfect. Thanks. So now that we have a sense of what funding was previously available, what funding had previously been accessed, and now we see what the ARP stabilization grants can be used for, let's get into why it's important to use these funds, right? And as I said, this seems to be the most flexible of the grants that have been released so far. And so the word stabilization is what I want to hone in on this evening, because I want you to think about not just your immediate needs, but I want you to think long-term, right? And what are your needs now? And what are your needs in the future? Okay, next slide. So this sounds great, right? But as you saw in our previous poll, not everybody is applying for these funds or the previous grants. And so we were asking why and contemplating what's holding people back. And we've heard, well, I'll have to pay taxes on the grant amount that I receive, right? Well, yes, this is true. It can increase your tax liability, and it can still provide new income, even if you have to pay taxes on it. And what we're going to share with you at the end of this slide are tips and tools on how to manage the tax liability component of this, right? So don't let that hold you back. You will benefit much more than you'll have to pay back in taxes. There's definitely return on this investment, and there's an easy way of making sure that you can have the records that you need in order to meet that tax liability. And we'll share some links a little bit later on. And next slide. The other concern that we've heard is, I'm going to be audited and I don't want the hassle of someone going through my records. This is true. You may be audited, and I emphasize the may be. And auditing means being prepared, and requires just a few simple steps that you likely already have in place, right? The intention of the audit, or if you are audited, is only to examine the federally funded parts of an organization's operations. It's not designed to identify unrelated problems, right? As long as you as a grant recipient maintain and keep accurate records of all your transactions conducted with federal dollars, you'll be fine, right? The key is record keeping. And we're going to also share some tips and some tools and give you some resources to help make that record keeping process easier. Another concern we heard was, it sounds great, but I can't access my provider profile in NJCCIS. Technology can be challenging, right? And there's help, right? So you can contact NJCCIS directly, and they can answer your questions about how to change your password, and if you're having difficulty logging in. If you're having a hard time getting in touch with NJCCIS, another great champion is your local child care resource and referral organization. They are great at making connections and getting you to the right place to help get your answers to your questions. Persistence is key, right? Next slide. This also sounds great, but I don't have time to complete the application. Yes, it says it takes approximately 45 minutes to complete the application, and an investment in time can increase revenue for your program, right? And so it's time well worth invested. And I'd like to share with you that we're going to give you some tools that you can use before you begin the application process, so that it will reduce your application time, right? Almost by half. So stay tuned. Sounds great, but I wouldn't know where to begin or how to use the funding, right? Well, you've come to the right place. This webinar will walk you through the process and give you tips on how to make the best use of those funds. So next slide. With all that said, let's just take a minute here and talk about this theory of stabilization. I want to really focus on that, because you are the backbone of our state. You keep families and our state employed. So without you, parents can't get to work, right? And if our economy and our workforce is dependent on having a healthy childcare system, then we need to stabilize that childcare system. And for too long, especially during the pandemic, you have been struggling, right? And trying to maintain a healthy and adequate workforce, trying to maintain a productive business, trying to maintain a quality program for the children and families that you serve. And so this is the time for you. This stabilization grant is intended to help you be the foundation that our workforce needs. I'm sure you've seen this analogy before of this three-legged stool, right? And it takes all three pieces to keep this stool stabilized. And I want you to consider the legs that make up this stool. One leg being your business practices, one leg being your quality programming, and the other being engaging in families, right? And at different points in time through the pandemic and even before and now, and as we're coming out, different legs may be stronger at different points in time. When all childcare programs were closed because of the pandemic, your parent engagement piece was impacted, right? Your enrollment numbers were down, or you didn't have enrollment, or you were completely closed, right? At another point in time, maybe your workforce was impacted. It's difficult to retain staff. It's difficult to find staff. It's difficult to keep staff engaged and to maintain staff morale. And then you also have your business practices, right? You may have had to take out loans. You may have had to dip into reserved funds to keep your program afloat. It's been a very trying time, but this is an opportunity to help build this back and to build back with a more stable structure. So as we move forward, next slide, please. We're going to look at ways to do that. So let's get into the grant. Okay, let's take a minute and get into what this grant is and what are the components. And what I'm going to do with you tonight is I'm going to bounce back and forth a little bit between actually going through what the application looks like and then giving you some supportive resources and giving you some tips and tools to help you get through the application process and also to think long term. Okay. All right, so let's start with the provider eligibility. So a little bit more unique than some of the previous grants is that providers not currently accepting childcare state subsidies are eligible to apply. So that's great because this means it is open to anybody who is either a licensed childcare program or a registered family childcare provider, right? Relative to licensed childcare programs, you can be private, you can be for-profit, you can be not-for-profit, you can be faith-based. All programs may be eligible. The key being that you must be licensed as of March 11th, 2021. So licensed by March 11th, 2021. You also must meet the Child Care Development Block Grant criminal background check requirement. Okay. Similarly, for registered family childcare providers, you must be registered as of March 11th, 2021. And you also must meet the Child Care Development Block Grant criminal comprehensive background check requirements. Next slide. Additional eligibility for programs is that you have to meet the CCDBG health and safety training requirements, and you must be in good standing. Okay. What does it mean to be in good standing? You, there can't be any enforcement actions, no violations, no suspensions or pending suspensions of your certificate of registration or of your current license. Okay. Next slide. So how do you access the stabilization grant? Well, you're going to access it through NJCCIS, okay? And so make sure that you are registered in NJCCIS. That's the first piece of this. You can submit one application per facility. So if you are a licensed childcare program and you have multiple locations, you can submit one application per facility. Each facility has its own unique NJCCIS ID, and that's the ID that you will use when you submit your application. So just make sure that you are already in NJCCIS. If you have any questions about NJCCIS, you can contact them, or you can contact Division of Family Development at their childcaregrants@dhs.gov. Next slide. So once you access the application, just so that you know, it can take approximately 45 minutes to complete the application, and it must be completed in one session. And for security reasons, the session will expire after 60 minutes, or if you've been idle for 15 minutes and your data will be lost. So don't let that discourage you, because I am going to give you some tools that you can use so that you can cut that time down in half. But it's important to note, because you're going to want to identify some dedicated time to complete this application, right? Sometimes I know as a former center director, I'd like to do stuff during nap time. You might be able to do this during nap time. Just know that if a child wakes or there's an emergency and you have to go tend to it, and you step away from the application, anything that you already entered is going to be lost. So I just encourage you to make sure that when you sit down to do this application, that you identify someone else to be around to handle emergencies, and that you have really set aside time for yourself to do this uninterrupted. Applications are accepted through April 30th, so there's still plenty of time to get this in. And the other thing to know is that some of this information that's in here is already pre-populated. However, if what's pre-populated is incorrect, you're going to want to contact the Division of Family Development, Child Care Grants at dhs.nj.gov, because they will be the only ones who can help correct that information. Next slide. Okay. So this is what it looks like, right? When you log on to NJCCIS, or you go to the NJCCIS website, I should say, you need to enter your email and your password, click that you agreed to their terms and conditions, and then it will take you to your provider portal, right? So make sure that you have your email address and your NJCCIS password. You can complete this application on a laptop, on a computer, on an iPad. Just make sure that if you are completing it on a device that you don't typically use, where you might have your login information saved, that you have that information so that you can log in. Next slide. Okay. So then you'll see a screen similar to this. This is what it looks like for licensed childcare centers. Just want to note that it is a universal application, which is somewhat customized depending upon your provider type. So what I mean is that there's a universal application, but as you log in, if you're a licensed center, it looks a little bit different for you. And if you're a registered family childcare provider, it looks a little bit different for you. However, there are some fields that show up in both provider sides. And so I'll just give you a little clarifying information around that and make it a little bit more familiar for you. So you will select grants, and then you will select the ARP grant. Now, I just want to point out, next slide, that if you don't see the option for the ARP grant in your provider profile, it may be because you're not identified as an eligible provider. In that case, I would say contact Division of Family Development, right? For some reason, maybe your certificate of registration expired, or you had a temporary license and it hasn't translated in the system yet. So if you don't see it, call NJCCIS or call Division of Family Development and see why it's not showing up in your provider portal. Okay, I think I said next slide. So now you're going to see a new grant application button, and then you would click on that button. So before you get started, here I'm going to go over some high level, and I'll get into this a little bit deeper as we move through the presentation, but this is the information you're going to need in order to complete this grant, okay? You're going to need your program information, which includes your NJCCIS ID and your program type. And I'll tell you what program type is in a little bit. You're also going to need your hours of operation. You're going to need your enrollment information. If you're a licensed childcare center, you're going to look at enrollment information in 3 ways. What is your total capacity by age group? That's related to your license. And if you're not sure what that is, you can contact your Office of Licensing Representative. You're going to need your total enrollment by age group, right? Which sometimes varies because you have a capacity number and an enrollment number. And oftentimes I know providers like to enroll less than their capacity, right? And so that's okay. They're just going to ask to see both numbers. And then you're also going to need what your average enrollment was by age in February of 2020. So that's February 2 years ago, okay? So whether you were able to pull back your enrollment data from attendance records, or if you have a software system that you use, you'll be able to pull that up. Or if you have a record of past sign-in sheets, but something that's going to give you parent contracts, could be something else for family childcare providers, but something that's going to give you your average enrollment in February of 2020, right? The next component you're going to need is staffing information for both full-time staff and part-time staff. And the application puts staff in 3 different groups: administrative, support, and educator. And so we'll keep that in mind as well. And then you also need to enter an current estimated monthly expenses, right? And here's just a quick example of what types of categories fall into monthly expenses. And we're going to take a deeper dive into this as we move along in the presentation. Next slide. The last component that we're going to talk about here is your banking information. And so your grant will be sent to you direct deposit. And so you'll need your routing number and your bank account number in order to put that into the system. Now, the system does verify this information. So if it's not able to be verified, there is an option to select a paper check to be cut. Okay. Next slide. So I want to bring your attention to a few handouts now that we're going to drop in the box for you so that you have easy access to them. As I said before, I have some tools that are going to help you get through this process. So the first is a pre-application checklist, okay? And so all of the things that I just went over, I have condensed in this pre-application checklist. I highly encourage you to download the pre-application checklist and print it and use it to write notes on. So you can go through each item and gather your data and information on that pre-application checklist. Okay. The next thing that I have for you is a quick monthly expense calculator. It's an Excel spreadsheet that has a formula in it, and it has expenses by category with a brief description to help you identify what types of expenses will meet or fall into that category. And then an option where it will, you can enter the dollar amount that you spent, an estimated amount in each of those areas. So, if you're a licensed childcare center, it feels like it's a little bit more straightforward. You can look at receipts that you've had. You can look at check banking accounts and checks that you've written to help identify some of these costs. If you're a registered family childcare provider, I have an extra handout for you and an extra tab for you in this quickly a month expense calculator handout. And that is the time space formula. So there is a one pager that was put together by Childcare Aware of New Jersey, and it gives you the formula on how to calculate how much of the percent of an expense you can claim. What do I mean by that? So for example, let's use your mortgage, right? You both live and work in your home. So your mortgage is not 100% a business expense, but there is a formula that you can use that will tell you what portion of your mortgage you can claim as a business expense. And so I just want to make sure that you're taking those expenses into consideration when you think about your total monthly expenses. And we'll take a deeper dive into how to exactly use both of those tools when we do the small group sessions. But I also wanted to share it with you all here so that you have the opportunity to use it on your own as well. Okay. Next slide. So accessing the grant. So as far as the next steps go, you're going to go through a series of clicks before you actually launch the application. You're going to see a new grant application button. You're going to see the ARP Stabilization grant button, right? So you see new grant application, and then you're going to look for ARP Stabilization grant button. It's going to bring you to an instruction page where you're going to see your NJCCIS ID number. It looks like this. I'm sorry, next slide. So you'll see the instructions, and then you'll see your NJCCIS ID. You want to write down your NJCCIS ID number. You can write it on that checklist that I have for you there. And once you write that down, then you're going to click on the button in the bottom that says Launch Stabilization Grant Application. Okay. Next slide. Once you launch the application, you're going to come to a screen where you're going to enter your NJCCIS ID. If you're a licensed childcare center, you're going to click search and select facility in the event that you have more than one location, and then you would click next. I want to just let you know that you will need to validate your account. So when you do this, be sure you have access to your email. NJCCIS is going to automatically send a verification email to your email address. You'll need to go to that email address, verify the account before you'll be able to move on through this process. So again, if you're working from a different device than you normally would access your NJCCIS provider profile from, you're going to want to make sure that you have access to your email. Next slide. Okay. And so now you're ready to apply. You're going to be able to click the application, apply now. This is when the clock starts for you. Okay. So, but again, please don't let this time pressure or what feels like might be time pressure deter you. If you do all the work in advance on that pre-checklist, you can breeze through this. Okay. Next slide. Okay. So this is the general applicant information page. This is what you'll see once you launch the application. What you'll need to do, as I said earlier, this is a universal application, and a lot of this is going to be pre-populated for you by NJCCIS. So anything in gray cannot be edited. If there is an error in any of the areas that are in gray, you'll need to contact the Division of Family Development so that they can make those corrections for you. But at this point, you're verifying the information that is in this system, and then you are going to fill out the bottom portion here, which is the director or owner, if you're a family child care provider, race, ethnicity, and gender. Okay, and then you're going to share. Then you'll go on to the next. And the next screen, this is operational status. This is where you're going to enter your operational expenses. So we talked about pre-calculating them earlier. This is where you would enter that dollar amount. We're going to take a little bit of a deeper dive here, but I just want to go through the items on this screen with you first. Okay. This is also where you're going to select your program type. Remember I said earlier, it asks for your program type. If you're a licensed child care center, you're going to have multiple types come up. One being school age or before or after school program, a private school, an early Head Start child care partnership, a Head Start and child care partnership, or none of the above. If you're a registered family child care provider, the options that come up are school age and before and after school, private school, or none of the above. And unless you are solely a before and after school program, you will likely probably select none of the above if you are a registered family child care provider. The next three questions are just validating some of the eligibility that we talked about earlier, that you were licensed or registered on or before March 11th, 2020, that you were operating, and that you meet the DFD requirements for CCDBG training and fingerprinting. So those are yes or no buttons that you would just hit. The other question that comes up here is whether or not there was a request for a sponsor change. This is where the universal application I mentioned earlier comes into play. That applies if you're a licensed center, but it will not apply if you're a family child care provider. Okay, next slide. So let's take a deeper dive into these estimated total monthly expenses. So at the baseline, right, your sort of baseline practice here is you have a receipt for every penny you spend in your business, right? Very simply, you keep all your receipts for anything that you purchase for your business. On the best practice side, you would be marking those receipts with, how much of them, what percentage of them are a business expense. If you're a registered family child care provider, that's where you would use your time space percentage to help you identify what portion of your receipts you could use. So for example, if you bought a box of markers, that's 100 for an art project, that's 100% business expense for your family child care providers, right? If you bought a area rug, well, that is also in your home. So you couldn't do 100% of the area rug as an expense, but you could do a portion of that based on your time space calculation. The other component of a best practice is organizing your receipts, right? So marking them and organizing them by category. If you go back to that calculator that I shared, or even the areas in which you can identify expenses, organize your receipts in those categories. An even better step is to track them in a spreadsheet. And I have a sample for you at the end of the presentation. And then I think the ultimate best practice, right, sort of the gold standard, would be utilizing a childcare business record keeping program. And there are lots that are out there, right? There's ProCare, Wonder School, the Red Leaf Calendar Keeper for family childcare providers. Wonder School works for both family childcare providers and licensed centers. And by no means are these endorsements, but just examples of software programs that are out there. So I'm going to take a minute and stop here for a minute. And I'd love to touch base with Winifred and Charnette about their experience with how they estimated their monthly operational expenses when they went through the process. So Winifred and Charnette.
So I'll start if that's okay. I can tell you, for me, we use a childcare software program. And so for us, it was just literally running the numbers that were required and able to pull those numbers off and plug them in. That seemed to be the easiest. We did have to do a little calculating, but for the most part, it was just kind of plug and play.
Great, thanks. Charnette, how were you able to come up with your expenses for your application?
So likewise, as Winifred mentioned, a lot of it had to do with calculating a lot of receipts. For us, it's a little bit easier because everything is pretty much straightforward. We have an account that's specific to the business. So everything that we do that pertains to the business, everything is already calculated through that account.
Great, thanks. So on the best practice side, it makes the process a bit easier, right, when you have these things in place in advance. But don't let that deter you, right? Because it doesn't stop you from being able to come up with a good best estimate of what your expenses are. And we'll talk about lessons learned, right? So as you go through this process, it's also an opportunity to learn and grow and improve the practices that you currently have. Thanks. All right, so we'll go to the next slide and let's talk about what are monthly operational expenses. Like what falls into these categories? Well, things like advertising, your car, or if you have a licensed center and you provide transportation and you own a vehicle, if you're a family childcare provider and you use your car for transporting children, a portion of that or your mileage can be considered an expense. Insurance, other than health, your liability insurance, bank charges, books, computer software, education and training, your telephone, employee benefit programs, wages, office expenses, rent of your business property, a portion of your mortgage, repairs and maintenance, supplies, utilities, food, toys, cleaning supplies, legal fees, professional services, and we could go on and on, right? I want you to think comprehensively. I want you to consider all of the things that come into running your business, because this is an opportunity that you can leverage all of those expenses. I just wanted to touch base with Winifred and Charnette. Did I miss anything here? Was there anything different that you all identified as an expense when you were doing your application?
I think that's a pretty comprehensive list. I can't think of anything.
Okay, thanks. Charnette, how about from a family childcare perspective?
Likewise, very comprehensive.
Great, thanks. Okay, next slide. All right, so, it can feel overwhelming. Where do I begin, right? Your expenses include what you spent money on, right? So begin with collecting your receipts, review your credit card bills, check any apps you use like Venmo or PayPal, and look at your bank statements. So if you haven't been collecting the receipts in an organized way to begin with, start by using these documents to help support your business expenses and help you identify them. I think what also happens is we just get into a groove, right? We're grocery shopping and we're picking stuff up for childcare. We're running to BJ's or Costco or a wholesale chain, and we're picking stuff up for childcare. And it's very easy to say, oh, I'll let that one, I'll just grab that. you want to capture all of that, right? And the time that you spend with art supplies and cleaning supplies and picking up that extra roll of paper towels or toilet paper for your program, right? Look at them, look at the documents that you have, be able to identify the expense, how much that you paid, the date that you paid it, and a quick description of what it was. The application is asking for an estimated monthly total, right? Meaning on average, how much do you spend in a month to operate your business? Okay, next slide. So this brings us back to the application. And so here, this is where we get to child count information. And as I mentioned earlier, it asks for your capacity by age group. And age groups are infants 0 to 17 months, toddlers 18 to 35 months, preschool 3 to 5 years, and school age over age 5, right? And so if you're a licensed childcare center, it's going to ask for your capacity, and then it's going to ask for your enrollment, and then it's going to ask for your enrollment in February 2020. If you're a family childcare provider, it's going to just ask you for your enrollment by age group and then your enrollment in February 2020. The other thing to keep in mind is the total. If you're a family childcare provider, it may stay 0 and it's grayed out here. You'll notice at the end, when you verify your application, the system populates that for you. So don't worry about that on this screen. It will happen at a later point, okay? And so I want to just take a minute here, and we're going to launch our next Zoom poll, because I'm curious, when we're looking at enrollment numbers, how satisfied are you with your current enrollment levels? I know it's been difficult, especially as we are recovering from coming through this pandemic, and when children are getting sick and children are staying home for longer periods of time, or parents are staying home for a period of time, or siblings had to stay home. And I think we probably are seeing large swings in enrollment in a way that we haven't seen before. And so it's hard to run a business, right? When you are unsure of how many children you're going to have in a class or in a group size that day, and how many staff you're going to need because of those sizes. So once we get an answer, all right, we can share that. Great. Thanks, Catherine. And so we have some really mixed responses there. That's helpful information to have. Thank you. Next slide. So this is the part of the application where you're going to put your staff count information. So here it looks at full-time and part-time, and it groups staff into 3 categories: administrative, which is director, owner, sponsor, facility manager, or something like in an administrative role; support staff, which are your janitors, your bus drivers, your cooks, anyone who is supporting your program in that way; and then educators, your teacher assistant, your group teacher, your lead teacher, anyone who is really predominantly doing the educational component of your program. And so make sure you count yourselves in these numbers, right? Because you are a key person in your program, especially if you're a registered family childcare provider. You're running your program, so make sure you count yourself as staff. If you don't have staff in a particular category, make sure you put 0. And there is a definition there of what the staff categories include. So we're going to launch another Zoom poll, because I'm curious to hear from you. For those employees, for those of you who have employees, how did COVID-19 affect your employees? Did they go down? I mean, I think that, as a former child care center director, right, it was always difficult to recruit and retain staff, even when I would say we were in the best of times, right? And in this COVID environment, it really, I think, has put a stress not only on child care centers and family child care providers, but the child care workforce as a whole. And so I'm curious to see if we have the results of what the status of the workforce has been during this pandemic. From what we're hearing is, thank you, Catherine. Yes, So as you can see, more than half of you are saying that your employee numbers have gone down, and that doesn't, you're all in the same boat, not the best boat to be in, right? But you're all in the same boat, so you're not alone in that. Okay, next slide. So then once you do that, what you're going to get is an estimated grant award amount, right? So licensed childcare centers, these grants can go up to $120,000. There's a formula in place that on the DFD side that takes into account capacity and monthly expenses. For registered family childcare providers, your grant is $4,000, okay? And for both types of providers, the grant is going to be issued in 2 payments. For family childcare providers, you'll receive $2,000 within about 30 days of the application being approved. And then at the end of the year, 12 months later, the other half of that grant. For licensed childcare centers, you'll receive a portion of your grant award upfront, and then the remaining portion at the end of 12 months. Okay, so you want to take note of your grant award amount here. So you can write that on that checklist because I want you to think about how you're going to use those dollars and use them intentionally. Next slide. I also just want to let you know that there is a recertification process. So this goes hand in hand with the second issuance or the second payment of your grant, right? And so it's really important that you are maintaining records of how you're using these dollars, but that you're staying open, right? And so 30 days before the end of before the 12-month recertification period, you'll receive an email to confirm the information that you provided on your application previously remains the same. And once recertified, then your payment will be issued. Next slide. Okay, this is where you get to think differently. Okay, so in this section, you are going to project how you're going to use your funds. And you're going to identify by category the dollar range in which you anticipate that you're going to spend those dollars. So I want to take a little bit of a deeper dive here with you all. Next slide. I want to bring you back to our original stool metaphor here, right? And I want you to think in terms of assessing and prioritizing your business needs. If you're thinking in terms of the 3 legs of this stool being business, quality program, and engaging families, I want you to think about right now, where are you wobbliest? Which is the most immediate need? I want you to also consider long-term investment ideas, okay? You have the ability with these funds to think in those terms. We haven't had this opportunity before. And I want you to plan your spending approach, okay? Invest in your workforce, including you, right? Your quality program leg. Reduced fixed costs. Look at utilities and rents and mortgages and technology, and that being another leg, right? And also look at quality program. Join professional organizations. Invest in benefit programs. Look at family engagement and how to have a supportive and culturally sensitive environments, right? Think immediate and think long-term. Next slide. All right, so here are some ideas. For personnel costs, and here are some opportunities and things to take into consideration, right? Increase staff pay and benefits. Look at one-time pay differentials. Look at bonuses. How often have you been able to do that, if ever, right? And so the only thing I would remind you is that whatever you choose to do, make sure that it's equitable or that you have some rules in place guiding those decisions, right? You don't want it to be purely, subjective. Well, I think I'll give this person X amount and this person B amount, right? You want to make sure you have either a decision matrix in place, or you want to use a rule of thumb of a, X% of salary across the board, right? So that there's an equitable distribution. Keep that in mind when you're doing that. Pay substitutes and allow some time out of the classroom for your teachers to do program and planning and invest in professional development. Establish retirement accounts for family childcare providers as well. You can do that, right? Think long-term, life insurance policies. I know oftentimes it's challenging for childcare programs to offer full comprehensive benefit packages, but here's an opportunity to start that, right? If you don't have anything in place, what about a life insurance policy for your staff? What about vision or dental? Those tend to be more affordable as a starting point. I also want to share the NJAEYC shared New Jersey Shared Services resource platform, right? There is access, I believe, and I could be wrong here, but I want to say it was like $8 an interaction for access to a doctor on demand, an app, right? Or Get Covered New Jersey. So think in those terms when you're thinking about personnel costs. So I'm going to just turn to Winifred and Shernette. Do you have any other suggestions or thoughts or ideas about how you were planning to use your funds if it related to personnel costs?
You know, one of the things that we did was all the staff that weren't eligible for the retention bonus, we definitely gave everyone else a bonus from this pool of money. And I think you've covered, I think we were able to hire, even though, you know, it'll take a little while, but we were able to put some money aside for hiring additional people.
Great. Shernette, how about you?
So for us, we were able to use the money actually to offset some of the expenses for cleaning. We do every 2 weeks because contrary to popular demand or popular beliefs, COVID is still not over. So every 2 weeks we have a cleaning service that comes in, and that helped to offset the cost for that.
Great, thanks. I've also heard like using sign-on bonuses, right? For those of you who have said it's difficult with finding employees, that you can maybe offer a sign-on bonus or an incentive to staff for referring new employees to your business or organization, just something else. So there are lots of creative ideas that you can use these funds for. And so in the chat box, you'll see a couple of handouts that I have for you as well. And one is setting up retirement plans, right? So listen, if you're like me, when I had to make decisions about retirement plans, I was like, that's way too much information, that I'm much better at planning a curriculum than I am at setting up a retirement plan, but there is help out there, right? And so I have a one-pager in there for you to help you get you started in thinking in that direction. And then there's also a one-pager from Child Care Aware of New Jersey about the health insurance coverage for childcare workforce. So again, things that you can start to take, thinking now and thinking in long term. Next slide. The next category is operational costs. So what falls under operational costs? Absolving arrears. Did you take on debt during the pandemic? Did you deplete your operational reserve during the pandemic, right? Your utility bills, are you behind, or or is it something that is now you're paying more because of COVID-related expenses? Rent and mortgage payments, business loans, marketing your program if you needed to rebuild your enrollment, and consider opportunities for growth here as well. Maybe you thought you wanted to add an infant and toddler program, but you just didn't have the funds that would help get you started with the equipment that you might need. Or maybe you wanted to add a school age program, but you just didn't have the funds to buy the equipment to support that age group. Or maybe you were thinking about a summer camp program and you, again, just didn't have the funds that would help launch that type of program. This could be an opportunity for you, right? So take those things into consideration when you're thinking about how you're going to use these funds. And so we're going to launch another Zoom poll for you all. And I'm just curious, have you taken on debt during the pandemic? It was tough, right? I mean, when your business is shut down, and even if you stayed open as an operating as an emergency childcare center, right, your numbers were so reduced. And for family childcare providers, your numbers are so small to begin with, right? So it's almost impossible to not have taken on some debt at some point during this time. And now as we begin to rebuild and stabilize, I'm going to go back to the key word in this grant name, right, is stabilize the childcare sector. Here's an opportunity to help do that, right, and help minimize some of that debt that we had. The next poll, oh, thanks, Catherine, great. The next poll has, did you have emergency savings prior to the pandemic in March of 2020, right? Were you able to pull from a reserve that you had in place? And if not, is it something that you're thinking about doing now, right? Like lessons learned, right? When you're in it, it's like, well, if I had a reserve, that may have helped alleviate some of the stress and pressure of getting through the time that your program was closed. So it's something you might want to consider as you're moving forward. And as you're able to leverage these grant dollars in other areas, right, it frees up funds for you to do these types of things, right? So just being strategic about how you're going to use these dollars. And so we'll see what the response is to that poll. Great. Okay. And then our last poll in this section is, if you had emergency savings, did you use it more or less during the pandemic? Right. And so when you have the ability to access those additional funds, it alleviates some of the stress and pressure, but it also puts pressure back onto you to replenish them, right? And it's hard to replenish when enrollments aren't back to where they were necessarily pre-pandemic, and you're still trying to recruit a workforce, and your expenses have gone up because you're doing more cleaning and sanitizing and replenishing materials in your program, because once, you know, if especially let's say in an infant toddler room and children are chewing and biting on toys, and you need to replenish those items a little bit more frequently. So thanks, Catherine. All right, and we'll see those poll results. Great, thanks. All right, so next slide. Maintaining a safe and healthy environment. So consider things like an awning for outdoor waiting areas. We know that when you had to do temperatures before families came into the program, and then it was raining outside and you didn't have a space, maybe you might want to be able to add an awning to the front of your building that would give you a protected space in the future, or in playground areas. Sometimes you need for shade to be outside. Something different to think about. Replace or upgrade sand or water tables that you've had outside, things that have been damaged. Adding touch-free garbage bins or touch-free soap dispensers, or anything that you can reduce high touch areas in. Air quality improvement, water quality improvement. Those are the types of things that fall into there. Professional development is another category, and you want to make sure that they're aligning with performance goals, right? That you're contributing to career progression. Do you have an adequate number of staff who are CPR and first aid certified? Do you need supports for your emergency preparedness plans, right? Joining professional organizations such as the National Association for Family Child Care, or the National Association for the Education of Young Children, or the state associations of those respective organizations. The opportunity to go to national conferences and hear and gain professional development from a national lens, making a commitment to doing that, right? The other category being equipment, supplies, and response to COVID-19. Those are, PPE, cleaning and sanitizing equipment. Touchless options are also helpful. Next slide. Mental health supports for children and staff. So this is an area that we haven't seen before. And the things that you can add here are an employee assistance programs, an EAP program, right? If you're not familiar, you can oftentimes they're linked with your hospital systems in your area, and they provide mental health supports not only for your staff, but for anybody who lives in their home. And they're really relatively affordable, especially if you've got access to grant funds to do that. Also, exploring partnerships with community providers. Next slide. We're looking at goods and services, these being materials and supplies that align with quality improvement goals. So if you're in Grow New Jersey Kids, what are the materials and supplies that align with Grow New Jersey Kids standards? If you're NAEYC accredited, if you're NAFCC accredited, what are the materials and supplies that align with those standards? And investments in developing social and emotional competencies. You know, do you have enough toys to rotate? Do you have enough toys to replace and replenish, especially when you've got infants and toddlers where wear and tear seems to happen at a higher rate? Next slide. I'm going to wrap this section up by just saying that business decisions should not be made in isolation, right? That they should be made in the context of supporting your workforce and the children and families that you support. And I'm going to build on the social emotional foundations for early learning pyramid model. So you may be familiar with the top 3 portions of this slide: having an effective workforce, having high quality supportive environments and nurturing and responsive relationships, having targeted social emotional supports, and intensive intervention. And what I added to this, to our traditional pyramid model, is stabilized businesses, right? Because you need a stabilized business in order to have these things, right? And so they go hand in hand, sort of going back to that analogy that we had with the 3-legged stool. Next slide. So circling back to the application, right? We're going to finish up the application here. What you're going to do is certify. So this is where you're going to enter your payment information. You'd identify direct deposit. You'd identify your personal checking account. I just want to share with you, this is also where you enter your routing number and your bank account number. What may happen, there seems to be a little bit of a glitch here in the system, and it's tied to the security feature. What the system does is verifies your routing and banking information. And so what that causes is for these fields to come up as yellow, and they may say, enter strong password, okay? So my tip to you is ignore that and enter your routing number and your banking account number, okay? You may get a prompt that's asking you to enter a strong password. I think that's tied to the security feature in NJCCIS. Once you hit validate, it will look like it stayed on the same page. What you'll notice is above your banking information, you'll see the word verified in green, okay? Then you would click next. So just a quick tip for this piece of the application. And then once you click next slide. Here's our final steps, right? You will review the application for accuracy. There's an attestation that you're going to acknowledge. You're going to select that you acknowledge the terms and agreements, and then you would hit submit. But before we hit submit here, I just want to go back to Winifred and Shernette and ask them if they have any other tips or suggestions or anything that they can share from their experience in filling out the application that you all might find helpful.
So I guess the one thing I thought about, like when you were going through the presentation, was make sure you kind of get a true estimate of your total expenses. Don't shortchange yourself or even the industry. The state's capturing this data for the ARPA funds, but we don't know like how they'll use this information later on. And caring for and educating little people is expensive. And we kind of want to make sure that as much as possible, we're capturing those real numbers so that the people who fund us will, who can give us funding, will understand that.
Great. Shernette?
And also, don't be afraid to make that phone call to NJCCIS. They have a wonderful team that is ready to assist you at any time if you have any issues. I did have a snag at one point, and I called up, and literally within seconds they were able to assist me, and everything went through great.
Thanks, Jeanette. Great advice. Great. Thanks. Okay. So then you're going to come to this screen and it's going to say application submitted, right? You're going to download a PDF version of your application. You can email it to yourself, you can print it, you can save it, but you want to keep a copy, maintain a copy for your records, okay? And then after you maintain a copy for your records, you will click, I'm done. Next slide. So how do we go from paper to practice, right? As I mentioned earlier, you're going to need to be accountable for any federal funds that you receive. So save all your receipts, right? Save all your receipts, make sure it has the name of the store, the date of purchase, the amount paid for each item, the business portion of each item, especially if you're family childcare, the description, and the method of payment. Also, you want to go back and you want to update your policies and procedures. If you've added a health benefit that you didn't have before, update your policies and procedures. Identify additional resources available. I'm going to share with you a mortgage grant that's out there currently, but not just that. There are other organizations that are providing PPE and cleaning supplies. So make sure you're leveraging what's available to you. Follow up with implementing the practices you have and identify and track any of your additional expenses, right? And so we're going to have in the handouts for you a quick COVID tracker that was shared through Child Care of New Jersey, right? And so you can track your expenses on there, and that will keep it in one location. Like I said, you need to be able to account for all the federal dollars that you receive, but it's pretty easy if you have some tools. I want to, next slide. Here is the contact information. As Sharnette mentioned, NJCCIS is available to answer any questions about your NJCCIS account or anything to do with the NJCCIS system or technical issues with the grant. For specific questions about the stabilization grant, you're going to contact NJ Child Care Grant Tech Support, and there's a phone number there as well. And for questions about policies, grant eligibility, and requirements, you're going to contact the Division of Family Development at dfd-childcaregrants@dhs.nj.gov. Next slide. Here's some additional contact information. Advocates for the Children of New Jersey, AC&J is great and is here to support you. This webinar will be recorded. All the handouts will be land on their website. Everything in this section that has a line under it is a link, so you can get access to the PowerPoint and you'll be able to hit the link and be brought directly to the tools that I've embedded for you. New Jersey Association for the Education of Young Children, especially if you're interested in the shared services platform. The National Association for the Education of Young Children, if you're interested in national level professional development. The National Association for Family Childcare Provider, if you're interested in becoming accredited. And also they have a national conference. Child Care Aware of America has some great resources, and Child Care Aware of New Jersey, which is your state child care resource and referral network, also has some additional great provider toolkits on their site as well. And next slide. We're going to just go into some of the tips and tools and resources that I had previously referenced. So we have handouts. Those are all in the chat box for you. Just recap them there. If you're concerned about auditing and being audited and monitored, just be prepared. And so there is one-on-one support that is available to all providers. And to register for this free support, it's confidential business counseling. You're going to visit the NJSBDC website, and the link is right there. So take advantage of that opportunity. Be prepared for being audited or monitored if that's a concern. These are great links to how to set up a record keeping system, business supports, basic bookkeeping links, expense tracker links, top 3 record keeping tips for family childcare providers by Tom Copeland. If you have concerns about taxes, these are great resources on how does the relief funding affect your taxes. Homegrown has a great resource out there for preparing for family childcare providers for the 2021 tax season. Child Care Aware of New Jersey has a bunch of one-pagers and handouts available for you. Next slide. This is the Emergency Rescue Mortgage Assistance Program. This is when I talked about leveraging resources that are available. If you're eligible for this grant, then you can redirect the funds from the stabilization grant to other categories. So just make sure that you're taking advantage of all the options that are out there for you. And then next steps are, as Cindy referenced at the beginning of the webinar, ACNJ will be hosting some small group sessions. What's in this presentation may be sufficient for some of you and to go ahead and apply for the stabilization grant. For others, you may want some more one-on-one support, a deeper dive into how to use the tools, learning how to use the expense calculator, learning how to calculate your space time percentage, those types of things. We'll get into that more intimately in those small group sessions. So keep an eye out for that. Next slide. And before we go into the Q&A, I just want to launch our last poll. And that is, given all the information that I just shared with you, which I know was a lot of information, how likely are you to apply for the ARP stabilization grant now? I hope by walking you through the application process, I've taken away some of the fears that you may have had, taken away some of the unknowns that may have frightened you off from applying. But now that you've seen what the process is, now that you know that if you do the work in advance, you can eliminate the time pressure when you go in and do the application. I'm curious to see if this has been helpful for you all. Great, super exciting. Okay, so with that said, I just want to say thank you. And I'm going to stop sharing because we are going to go into the Q&A now.
I do just want to say before we proceed to the Q&A, if you do have any questions, please make sure they're in the Q&A box rather than the chat box. That will greatly aid our moderator, so that way she'll be able to read through them. Just to let you know, this webinar is being recorded. We will be posting it on the ACNJ website. The links will also be available there. They are available right now. My colleague Aaliyah Rulak will be sharing that link. So that way you could download all the handouts that were referenced today, as well as this presentation. So Shernette and Winifred, if you would like to turn on your cameras.
Catherine, do you want me to just start reading the questions in the Q&A and responding to them?
That would be perfect. If you want
Okay,
to open
great.
up the Q&A, I see we have 10 and I see more coming in.
Great. Okay, so we've got will handouts be emailed to us? I believe the handouts are going to be made available on the ACNJ website, and you'll be able to access them from there.
Yes, I would like to address that really fast. We do have them available right now. Aaliyah did share a link. You can find them on the ACNJ website. We'll also be sending an email out to everybody with a recording of this webinar, as well as the links that are available.
Great. Okay. The next question is, how many hours per week would be considered full-time employee? Winifred, you want to jump in there?
I would say anything 30 and above would be kind of a good rule of thumbs for us. But during COVID, we've probably, you may have made some allowances.
I think that's a good rule of thumb. I think that I've also seen 28 hours. I think sometimes it's tied to what's benefit eligible. I've seen programs linked to what's benefit eligible, but and if you think in terms of, I'm also trying to think in terms of childcare subsidy eligibility, what's considered full-time. Isn't it 30? Is it 35? 30 hours?
I think it might be 30, but I'm not sure.
So I think that's
30.
good, it's 30, right? So that's probably a good rule of thumb to use there. Okay. Our capacity is 180 at the school at any time, but some kids come 3 days a week, some 2. some AM, some PM. So it looks like out of enrollment is 3 times capacity, but it's not. Is that a problem? No, right? It's not, because, you know, they understand that there are shifts, right? Similarly, you might have family childcare providers in the same situation, right? Their capacity is 5, but you could have multiple shifts. So as long as you're maintaining the appropriate ratios and numbers within your license for those shifts, you should be fine. Okay. Are Head Start and early Head Start childcare centers eligible to apply? No, right? So Head Start and early Head Start, there was specific funding that was granted and allocated specifically for Head Start and early Head Start. However, there might be opportunity if you have a Head Start or early Head Start partnership. And so I would refer you to the Division of Family Development to get clarity around what that looks like. But because there is separate funding that was issued by the feds for Head Start and early Head Start, they're not eligible for this particular grant. How do you bypass the banking portion of the application and request a check? So if you're entering, what happens is the system is going to want to verify banking information. So if you're saying that you don't have a bank account, I would double check with NJCCINS to make sure what you need to enter in there in order to have the paper check option show up for you. Go ahead, Charnette.
Hi, Rebecca. Yeah, just to answer that, there actually was a portion, there was a part that actually asked you if you wanted deposit or a paper check.
It comes up first, Charnette? I don't remember seeing.
Yes, it actually came up prior to you putting in the banking information.
Okay. Great, perfect. And there we go. The next question is, hi, can an FCC buy a fridge? Well, yes and no, right? So yes, you can buy a fridge. What percentage of the cost of the fridge that you'll be able to apply is going to depend on the use, right? So if it's a refrigerator that is solely dedicated for the use of your childcare program, and you can document that that's the case, then 100% of it can be charged there. If it's a fridge that's going to be used for both personal and business use, then you would use that time space percentage formula that is in the quick expense calculator to figure out what percentage of that expense you can use. So my answer that's going to be, it depends. And that's outlined in that time space formula 1-pager that will clarify that for you. Okay. Next one is, if our center was just relicensed, does the staff need to be re-fingerprinted again for this grant to meet CCDBG requirements? I'm going to refer to, you want to take that one?
So as long as everyone was re-fingerprinted, then you're fine. You do not need to do it a second time.
Right. And I would also say, when in doubt, contact your Office of Licensing representative, because they would have the intricacies of what transfers between, there's gaps in time that have allowances for some things and not for others. So I think OL is probably a good person to answer that for you, right? The retirement plan and link that was shared did not work. Can you repost? Yes, we can repost the retirement link. Thank you. Where we go? You're jumping around because I think more are coming in. There we go. We contract with NBPS to implement their early childhood program. Are we still eligible, as many of our expenses are covered through the contract? So, a good rule of thumb is, right, it's not, you just be careful about what might be considered or viewed as double dipping, right? You can't get reimbursed for the same thing twice. So I would say that if it's already being covered by another funding source, then you're not going to want to allocate it towards your grant funds. Go ahead, Winifred.
I'm assuming that might be like collaborating with like a public school or something along those lines. That person is asking the question. And the answer is yes, you can apply for the grant. And it's exactly what you said. The expenses you have to make sure are not covered by whatever dollars are being covered there. It's money that may be coming from a before care and after care program.
Okay, perfect. Thank you. During COVID-19, some of the facilities lost staff members. Do the loss of staff affect you being able to get funding and listing the staff section? No, not at all. I mean, you want to be able to show the staff that you have, but it doesn't impact your ability to receive funding on this one. Okay. Did I see health insurance is excluded? We are required by law to provide for some of our employees. No, health insurance is not excluded. You can be reimbursed for your health insurance premiums, right? So you can use your health insurance premiums are an expense that you can use the funds for. If you're a family child care provider, you can also use it for health insurance premiums, but you cannot pay a health provider directly, right? So if you had to go to the dentist, you couldn't use grant funds to directly pay the dentist. But if you had a dental plan, you can use the grant funds to pay the premium of your dental plan. Okay. We are a franchise daycare center. Would we be considered private? Yes. Right?
I think the answer is yes to that. I would just call NJCCIS just to verify. And the great thing about if you call, then they will actually document that you called. So if they tell you something wrong, then at least it's on them and it's not on you. Then jump out there by yourself.
Great. During COVID-19, some of the facilities lost staff members. Does the lost staff affect you being able to get funded and listing the amount of staff in the session? So we answered that one. Okay. Can you include overtime with employee salary? Yes, right? Yep. You can include overtime, you can include bonuses. Is this webinar introduced in Spanish? It was. The beginning of the webinar, there was a dual translation occurring. So it was in English and Spanish, which gave instructions for attendees to access the Spanish interpretation channel. If you don't have a management anymore, can you do anything regarding your property taxes? Oh, if you don't have a mortgage anymore, they're jumping around here. Anything regarding your property taxes that you have to pay quarterly. Yes, you can use the funds for anything that's in arrears, right? And you can use it to pay for your property taxes. If you're a family child care provider, again, it would be based upon that time-space ratio, right? It's not 100% because you live in that home as well, but that is an option. And in the link for at the end of this presentation, there was a link that had tax liability resources. You can use that to help guide you further. Okay. I'm sorry if I missed this part, but does the application make us detail exactly how we would spend the funds? It asks you to give a general idea or a range. So the application asks you to select the categories that you're going to use the funds for. And I believe there are 6 categories there. And then it does ask you to identify a dollar range, how much you anticipate to spend in each of those categories, right? So when you go to complete it. Now, listen, life happens and things change, right? As long as you are within what are allowable expenses and you maintain appropriate documentation, I wouldn't over stress about going over or under in a particular category, right? But when I was talking earlier about sort of being intentional, right? Listen, if you wanted to spend 100% of your grant in personnel, you absolutely could spend 100% of your grant in personnel. If you wanted to spend 100% of your grant in materials and supplies, sure, you can do that. But prioritize, right? And think intentionally about where are the soft spots in your program? And where do you want to start to think long-term and short-term, right? Get your immediate needs fit. If you have immediate needs, address your immediate needs, and then also see what you can do for long-term. My expenses last year were lower than this year because we had less teachers and less students. Presently, expenses are higher, and I believe they will be higher next year. Do I determine monthly expenses by what they are current since last year was low? I would use your most current expenses to complete this application. They're your most realistic, and it's what you're going to need in this current environment. So use your current monthly expenses. Can you talk about CCDBG required training for licensed childcare? Does every single teacher need to be CPR certified in order to qualify? So I would refer you back to the Division of Family Development or childcarenj.gov website, where they list all the training requirements. There's a Yeah, I'm going to refer you there because I have my licensing there's licensing requirements and there's CCDBG requirements, and I don't want to give you the wrong answer. So there is, and then there's a frequently asked questions document that we have together that has a link directly to those resources as well. Can Head Start and Early Partnership will be eligible to apply? Yes, I would contact NJCCIS or DFD for details around that, but under program type, it does give the option for you to select a Head Start childcare partnership or an Early Head Start childcare partnership. I think it likely is going to depend upon the award amount, but it doesn't deem you totally ineligible. So I would say follow up with DFD or NJCCIS.
Do you know what, Rebecca? We're at 7:56. I want to be respectful of everyone's time, and we're going to finish up. So maybe take one or two more questions, and then we can get from there.
Okay. What year should our expenses be when calculating? I would use your most current monthly expenses. It's just looking at your monthly expenses. So whatever your most recent expenses are, and they're going to be most reflective of what's happening. How do you update employees' mandated training to satisfy the prerequisite for the grant if it's not an NJCCIS? You're going to have to contact NJCCIS to do that. That's an NJCCIS systems piece. And we'll take one more. If you're a licensed child care center program that is part of a larger organization like a public school, can you claim some or all of the director and secretary salaries if they work directly with the program? If yes, and you have multiple sites, can you split the salaries between the sites? Okay, we picked a doozy for an end one, right? So each site has its own end, right? You have to fill out an application per site with each NJCCIS identifier. And so you would link the staff who are associated with those respective programs. I would refer you to NJCCIS if you've got a complicated situation like that, and have them walk you through how to do that. Okay. All right. Well, I thank you so much, Winifred and Shernette, for joining us this evening. I really appreciated your support and your experience and your depth of knowledge. Congratulations on receiving your grants. That's great. And we'll turn it over to Cindy, if you want to wrap us up with our.
Sure. So thank you all, Rebecca, Winifred, and Shernette. And I'd like to just take a second before people start getting off. We talked a little bit about those smaller groups. And what we want you to do is, if you are interested, and we're going to show this slide. If you're interested in maybe additional help, we're going to have some smaller group settings to help through the process. And we're going to go back a little bit before. Yep, this is the one. If you would put in the chat box, if you would put your name and your email, and identify the type of program that you are. So if you're a center-based program with more than 60 children, put that. If you're a center-based provider with less than 60 children, put that. If you're a family child care provider, put that. If you're a faith-based provider, please include. And if you're a provider who speaks a language other than English. So obviously, if you are a provider who speaks a language other than English, you're going to also be either a center-based or a family childcare provider. So you may have two things to put in. But again, if you're interested in the smaller groups, we would be happy. We may not be able to help everyone, but we will try to help as many people as we can. Please put your name in the chat box, and then we can get in touch with you in the future when we plan these smaller groups. Now we're going to have another webinar on March the 15th. We have recorded this webinar, I think both, I know in English, and I think in Spanish as well. So you can listen again, you can have your friends listen, or they can participate in a very similar presentation on March the 15th. The goal is to please don't be afraid and apply. So I want to take one more minute from my colleague Diane Delano to get on and just to talk about an opportunity you all have to potentially win $1,000. Diane? Diane, we can't hear you. Can everyone hear Diane?
No.
Okay. So let's pull up, yes. Okay, infant, toddler, childcare providers, center-based or family childcare. We're asking you to complete a survey. You can either complete it by the link below.
Yes. Oh, can you hear me now?
Yes, great.
Okay, sorry about that. I must have touched a button. Yes, thank you, Cindy. She started to talk to you about our survey that we're conducting to learn more about the availability of infant and toddler childcare services in our state. So what we're asking for is, you are a program that's licensed to provide infant and toddler childcare. We are sending out a survey, or you can click on this. We'll take a picture of this and scan it and answer the survey. And it'll also be going out in the mailing at the bottom, at the last slide. So you can click on that too. And you probably will be getting it in a couple of other emails as well. We'd really like you to complete this so that we can advocate on behalf of programs that are providing services for infants and toddlers. We really would like to learn more about how the pandemic has impacted the provision of this type of care and what we can do to help you out. So, and what we're trying to do is get as many responses as possible, completing the SurveyMonkey. And those of you that answer it via SurveyMonkey will be entered into a drawing to receive one of 3 $1,000 cash prizes. So please fill this out, and it'll only take about 8 to 10 minutes at the most. And a lot of the information that we're asking is very similar to the information that you're going to also be needing to provide for this grant as well. It has to do with your capacity to provide infant and toddler childcare and what you're actually providing care for infants and toddlers. So thank you so much for your time.
And everyone, that will conclude our event. Again, Rebecca, thank you so much. Shernette and Winifred, thank you. And to our ACNJ team who has been monitoring the chat and the Q&A, and our 2 interpreters, you've been great. And just apply. Thanks so much, and we hope to see you soon. Bye now.